I'm Jerry Hesch from the Hesch Institute in Aurora, Colorado, and this is a presentation on inferior pubic bone. I had a motorcycle wreck, a rather severe one at age 17, and caused damage to my low back and pelvis, and I developed hypermobility or instability in the pubic joint, in which the left pubic bone would orient inferiorly. And of course I didn't know much about treatment at that time, and the healthcare I sought dealt with hemorrhaging and things like that, but did not address that injury. Of course, in time I finally learned how to treat it, and it's been resolved for a number of years. It might occasionally recur. It's been more than a year since I've had to self-treat this, maybe several years. But when it is inferior, it of course was quite symptomatic, and I want to demonstrate a false positive. In this individual, their pelvis is oriented to the left, and so if you palpate the top of the midline, leaving a little bit of space for the fibrocartilage, leaving perhaps 1/4 of an inch, then we would say that the left pubic bone is inferior, but there is no step off. It's a straight plane straight across, so that doesn't qualify. That's just a positional asymmetry. When I'm speaking of an inferior pube, I'm speaking of a true inferior shift of one pubic bone in which there's a distinct step down going from right to left in this example, and a step up going left to right. These presentations will also have greater tightness and tenderness in the sacrospinous ligament on the same side. And the treatment that I use for this pattern is very gentle, and I simply capture the front of the pubic bone and partly capture the inferior aspect and glide it superiorly for 5 minutes. And of course there are other movement dysfunctions that may occur within the sacroiliac joint, especially because anytime you have movement in a pubic joint, you also have movement in the sacroiliac joint as well. So it may not present as a single thing that's wrong with this person in terms of pelvic girdle stability and mobility, but it is a significant piece of any pattern when it's present. The pubic joint has a profound effect on the sacroiliac joint, and I always treat the pubic joint first. And this is a presentation on inferior pubic bone on the left, and I describe treatment for that. And I evaluate it in all clients in our whole body approach. And our website is www.heschinstitute.com, and that's spelled H-E-S as in Sam, C-H. And I thank you very much. We'll be posting videos each week, and you can sign up on our YouTube channel, which is also named Hesch Institute, and Facebook group is also Hesch Institute. And thank you very much.